An exciting new development in dry eye treatment is the use of IPL, or intense pulsed light therapy. IPL has been used to treat dry eye for over 20 years. If we flash very bright, high-intensity red light through the eyelids, this has several beneficial effects. Firstly, it's an effect called Photo-Biomodulation. The small energy-producing units called mitochondria in the cells within the eyelids and the tear lipid secretory glands become less effective and sluggish over time. IPL effectively recharges or revitalizes our mitochondria so that the cells become more productive and secrete higher quality lipids into the tear film. The next major benefit of IPL treatment is that there is a reduction in the inflammation in the eyelids. This has several benefits, both directly and indirectly. Inflamed eyelids in dry eye become red and swollen and release histamines, which are pro-inflammatory and cause blood vessel dilation to occur. These can distort the shape and function of the oil-producing Meibomian glands. Additionally, the IPL light in the far red and infrared portion of the spectrum heats up the waxy secretions which have solidified in the Meibomian glands over time, making the lipids more flowable. This results in improved Meibomian secretions, reduced tear salt concentration or osmolarity, less tear evaporation, and a thicker, healthier tear film. The improved osmolarity provides a healthy environment for mucus-secreting goblet cells and improved tear breakup time. Additionally, the infrared component of the treatment beam has been shown to heat up the pigment of the shell of the Demodex mite and thereby eliminates this common pathogen along with harmful bacteria. There are several other claimed benefits for IPL on the eyelids and tear film. Due to the collagen tightening effect, IPL often results in wrinkle reduction. Other additional benefits include reduction in rosacea redness and removal of unwanted facial hair. Hair removal is more effective when the hair is of a darker colour. Often, freckles and age spots fade with the IPL treatment, though occasionally it is reported that they can darken in some patients. If we suspect this is happening on the first treatment, we avoid these areas on subsequent visits. Common criticisms levelled on internet forums about IPL treatment are that it may not be effective or that the skin can become overheated and blistered, a bit like sunburn. Generally, darker skin types are unable to tolerate high IPL treatment levels, as the melanin in the skin can absorb the IPL light and heat up. This means that lower levels are needed to achieve an adequate treatment. If too high a level is used for a given skin type, the overheating of the melanin can cause the sunburn effect. It's generally considered that Fitzpatrick skin types 5 and 6 are unsuitable for IPL treatment. Other reasons a patient may be unsuitable for IPL treatment are the use of certain drugs that cause photosensitivity, such as doxycycline, which should be stopped for 4 weeks prior to treatment. Additionally, patients with facial tattoos, a history of high sun exposure, use of artificial tanning products, or those with conditions such as lupus or melanin aggregation may be unsuitable for IPL. Face makeup should not be worn for at least 1 day before treatment, and patients should avoid products containing retinoids, for example, retinal, retinol, etc. Before the treatment proceeds, the power and flash characteristics are set for each patient to ensure that the brightness of light used is appropriate for the individual patient and their skin type. This ensures that a bright enough light is used to get the maximum effect without causing collateral damage to the skin. Usually, slightly brighter settings can be used on subsequent visits, as the sensitivity of the eyelids and skin reduces with each treatment. This means that the treatment is even more effective with each subsequent visit. In most cases, a series of 4 to 5 treatments is required. spaced 2 to 6 weeks apart. Maintenance treatment normally consists of 1 treatment per year. The Luminous M22 Opta IPL machine we use does not suffer from degradation of the treatment flash over time, and our machines are calibrated and serviced regularly, maintaining them in the highest condition. Before starting IPL, the patient is reminded about exactly what is involved and has the opportunity to ask questions. Following this, the patient reads and signs an informed consent form. Initially, protective patches are placed over the closed eyelids to protect the eye itself from the bright treatment light and also to protect the eyelashes. The optometrist doing the treatment will also need to wear protective eyewear. The area to be treated is coated with a cooling gel that reduces the likelihood of hotspots forming during treatment and ensures that the treatment of inflammatory blood vessels is more efficient. The optometrist sets the power settings, pulse duration, and pulse frequency. Skin sensitivity is established by administering a test flash to the temple area. Once it is established that the settings are appropriate for that particular patient, the process can go ahead. A series of flashes are applied to the eyelids, upper cheeks, and nose area in an overlapping fashion, as in this diagram. Basic treatment typically involves 3 sweeps from ear to ear of about 14 treatment areas, leaving a delay time of about 20 to 60 seconds between each sweep. During treatment, the patient usually feels a warm but slightly unpleasant tingle with each bright flash of light. This can be slightly less comfortable in areas with more inflamed blood vessels in the skin, or pigmentation such as freckles, which warm up to a greater extent because of their melanin content. It is normal to perceive a bright flash even though your eyes are covered. This is not dangerous. With each IPL flash, an audible clicking sound will also be heard. It is not uncommon to encounter a sort of singeing smell during treatment. This is normal, as our faces have many tiny hairs on them. Next, the treatment gel and protective eye patches are gently removed. Following this, heat expression of the Meibomian glands is often carried out to maximize the beneficial effects of the IPL treatment. For 2 to 3 days following IPL treatment, it is advisable to use moisturizer or a sunscreen to protect the skin. Here is a patient with advanced dry eye and Meibomian gland dysfunction. The infrared meibography image shows significantly shortened, blocked Meibomian glands, with several gaps between them where atrophy has occurred. This can be compared to the image on the right, showing the longer, healthier glands in a patient without Meibomian gland dysfunction. This image shows the clear, healthy lipid secretions of a patient having had IPL treatment. Here, one of our patients shares their experience of IPL.
So I'm now about to commence on my 3rd treatment, but all I can say is the 2 that I've had already are already working. My eyelids feel cooler, my rosacea is already feeling calmer. My eyelids, on the edges of my eyelids, feel much cooler, almost like they've got a wind on them now, which proves to me that how hot and sore they were. And I can totally recommend having IPL. It's slightly stingy when it's done, but it's just a slight discomfort, and it's totally worth going through.
To summarise, IPL is a major advancement in modern dry eye treatment and is a fantastic tool to increase tear volume and restore normal tear chemistry. It offers real hope for those patients suffering from this extremely prevalent and often debilitating condition. We are proud to offer this service at all our practices. Please see our website for further details. The link is below in the description of this video. Thank you for watching.